Milwaukee. I'm here to do a pediatric assessment today. We have a 1-month-old little girl here with us today. We have done our general principles and safety practices. We have just walked in the room with the guardian and the infant, and we want to look at the environment and make sure the environment's safe. Look at the demeanor of the mother or the guardian and the baby. We want to look to see if the baby is consoled by the guardian. And then we have already asked the guardian to undress the baby. And we have a 1-month-old here. And at this stage, they really can't do very much, but they can turn their head from left to right. We have undressed the baby, and we looked at the baby when it had clothes on, and they were weather appropriate. We are going to grab the baby, we are going to remove the diaper, and we are going to go weigh the baby. Whenever we stick the baby on a weight, we are going to have a scale pad, and we're going to make sure the scale is zeroed. And then we would stick the baby on the scale, and we would make sure we hover our hand over them without touching the baby to prevent the baby from rolling off and for the baby's safety. And after we have got the weight, we'll bring the baby back. We will cover her back up. And then now we are just going to look over the baby completely. We're going to look at the skin. We're going to look for any discoloration, any rashes, any bruising. We're just going to look at it all over. I'm going to go ahead and get the measurements. I'm going to do this one at the eyebrow line. And we have 14.5 inches. We have 13 inches on the chest. We're going to do this from here at the umbilicus line. And we have 14 inches. And we are going to do the length, and we would have one of the length boards, and we would do that from head to toe. We want to make sure that the leg is completely straightened out. And if the leg was completely straightened out, she would be 21 inches. And after we have done our vital signs and collected all of the data, we would look for prior immunizations. We'd ask the parent about prior immunizations. And then we're going to move to the head. We have the anterior and the posterior fontanelles. Since this little girl is 1 month old, both of them should be soft. The posterior closes 6 to 8 weeks, and the anterior closes 12 to 18 months. If they are sunken in, that could indicate dehydration. If they are bounding, that could mean fluid overload. If they're bulging, that could indicate shaken baby syndrome. And if they're soft, that is normal. Then while we are at the head, we're going to look at the placement of the hair. Are they bald? Do they have a lot of hair? Are they bald in certain spots of their head? We're going to look at the shape of their head. Then we're going to move to the eyes, nose, mouth, and ears. And we're going to look at the eyes, and we're going to compare them to the placement of the ears. And if the ears are a little lower than the eyes, that could indicate Down syndrome. We are going to look at the pupils for equal and reactive. And we're going to look at the eyes for any drainage. And then we're going to move to the nose. And we're going to look up the nose. And we're going to look for any drainage, a deviated septum, or anything like that. And then we're going to do the mouth. And this baby is 1 month old, so she shouldn't have any teeth, but if they were, you would count the teeth and see how many they had. And then you'll look at the mucous membranes and make sure that they're pink. Then we're going to turn the infant's head, look in the ears. We're gonna look for the amount of earwax or any drainage from them. We're gonna look at the eardrums on both sides. And then we might clap to do the startle reflex, or we check all the reflexes, possibly the grasping reflex or the rooting, and we would make sure that they were all intact. Then we're going to move down to the neck. We're going to check all of the lymph nodes and make sure that they are non-palpable. And we would do all that. We would look at the folds as we're down here at the neck, and we would look for any rashes, or any rawness from drooling or from milk being there. And if the mother is using any ointment to help get rid of this rash or rawness. And then we're going to move down to the chest, and we're going to do our cardiac assessment. We are going to listen. We've got the aortic, the pulmonic, the Erb's point, the tricuspid, and the mitral. We have listened to all the heart sounds, and then we are going to do the pulses. We are going to do the carotid separately. We're going to do the brachial bilaterally, radial bilaterally. The femoral, we may have to remove the diaper for this one. Do all the others bilaterally. And then we're going to do capillary refill. We're going to check all of the capillary refills on each extremity and make sure that they are even. And then we are going to, at the beginning, we looked completely over the baby, and with the cardiac, we would look for any discoloration, like the bluish feet or hands or nose or lips or ears, just any blueness, any cyanosis anywhere. And then we're going to do the respiratory assessment, and they are abdominal breathers. So we're going to look at their work of breathing, and we're going to listen to the 10 points on the front, the 4 points on each side, and then the 10 points on the back. And then while we have the baby standing up here, looking at their back, we're going to look at their back for any rashes or redness or bruising or anything back here. And so we have done the respiratory, and we've looked at their work of breathing, their respirations, and we've listened to their lung sounds, which are clear. And then we're going to go to their gastrointestinal system. We were going to observe the belly. We were going to listen to all 4 bowel sounds. We're going to palpate and percuss if needed. This is whenever the guardians would come into play. We're going to ask them, how many bottles a day does she eat? How many ounces per feeding does she eat? Does she have issues with spitting up? And then we're also going to ask about their bowel sounds and their urinary. What do their bowel sounds look like? Do they have an odd odor? What's the consistency? How many do they have? And then with urinary, we're going to ask, how many wet diapers do they have? Do they have a specific odor or color to their urine? And we're going to listen. And after we have done listen to their bowel sounds, we're going to look at their genitalia. And we have a little girl here today, so we were just going to look for any rashes in her folds, or and a little boy would look for see if they've had a circumcision, and we're going to look for any drainage. If they've had any abnormal drainage, and that would be for a girl or a boy. And we've already got the urinary out of the way. we're going to look at the musculoskeletal. We're going to move to the muscles. We're going to do the range of motion of all four extremities to make sure they are equal. And we're also going to do range of motion with the head. And then we're going to look at the muscle tone of the baby. We're going to make sure they're equal on all four extremities. And then, like I've mentioned before, we're going to look at completely over the baby. We're going to look for any bruising, discolorations, any rashes. And this baby is got normal pink skin. And then we're going to put the clothes back on the baby, cover the baby back up, and give them back to their guardian.